my name is Jada Adams, and on April 7th, I was in the OB triage unit. I think the most important initial questions to be asking your patient, my nurse was telling me most important was our first set of vitals that happens in the first 10 minutes of them being admitted to us. So most importantly, we want to ask them about pain and then have they felt their baby moving, because we want to make sure there's no fetal demise situations going on. And if there are, we want to be able to treat those as fast as possible, because minutes matter and everything's going very quickly. In a time where we saw very clear communication, we had a patient come in with preeclampsia, and when we were trying to set up all of the medications for her, such as the magnesium sulfate as well as labetalol, because of her extremely high blood pressure, we had another triage nurse that came in, and they worked very seamlessly together. And I think that a lot of it goes in part because of the fact they've worked together for a long time, but also just knowing what your counterpart needs for your care of the patient, and making sure that you're coming in immediately and willing to give that help. And honestly, there's not really a need for excessive communication there. What they kind of did, it was like almost like an eye thing they did. They were really able, like in sync, to really give the care to the patient that was needed. So I think that's probably the most important communication, as well as I saw my another nurse that was giving report to a nurse practitioner to get additional medication for another patient. And what I appreciated in their technique was the fact that there was active listening going on. The nurse practitioner was very engaged in the conversation to get all of the full information, asking additional questions when necessary. And the nurse that gave the report was extremely thorough as well with her report. Really just kind of impressing to me how thorough we need to be with our doctors and our providers when giving that information for patients that need more medication, need more help, and that orders we can only get from doctors and nurse practitioners. But yeah, I think that was probably the most important there. Let's see. So being a triage nurse, contributing to the flow of patient safety, is really just being on your P's and Q's. It's very much being in the ER, and unfortunately we don't necessarily have a diagnosis to go off of. We kind of just have the patient in front of us and the information that we have that they've given us, and we have to provide care based on that information. So most importantly is being up to date on typical diagnoses that we would usually see, being up to date on what symptoms could possibly be shown by patients that have things like that, but then also being willing to listen to the patient and to be able to ask inquisitive questions. My nurse was very good at being very very approachable for the patient to be able to ask her questions, to tell her and voice her concerns. And if our patients aren't comfortable with us to voice their concerns, it's very possible that we could miss things. And when we miss things, there could be dire consequences, such as fetal demise, the difficulties of the mother, of course. And we just would never want to lose someone on our watch because they didn't feel comfortable enough with us to tell us what was going on. I think the thing that I'm most curious to kind of learn is kind of going a lot more in depth on reasons for early C-section. I know in class we kind of skimmed over it in terms of things that we would rather that are more dangerous to the mother to remain pregnant, but I would like to kind of dive deeper into different symptoms and problems that they may face. Because I know my first patient, being preeclamptic, she came in, and after coming in at 7, they scheduled her for a 9:30 C-section because she had preeclampsia and blood pressures of 180 over 106 or something along those lines. So I would like to kind of get more in depth in where do we know to kind of alert the doctor or the provider about, hey, they're having these symptoms. I think what would be most important for them, kind of recommending that C-section, and where it would probably be best to be hey, I think they can just deliver vaginally and naturally on their own. So also I think knowing when Pitocin is necessary to use, because there are so many different times when Pitocin can be used, whether that is for induction or even after birth to have the uterine cramping so that we can fix possible hemorrhaging and things like that. So I think I really want to dive into those two things. had a patient that we found no heartbeat when they came in. I think kind of how I would approach it is immediately just like, you know what, I'm so sorry. There's an immediate pain in me for you immediately, and I am here for whatever you need. Most importantly, I am present and here with you. So if you want to cry, I'm right here. I'm the shoulder to lean on. If you don't want to cry, if you just want to sit here, I'm here as well for whatever it is. And also, what comfort measures can I provide to you? Not necessarily, I wouldn't say it in that way specifically, but just what can I do to help? I don't never want to be a person that wants to assume this is what you need. So definitely asking, what can I do? I'm so sorry that this has happened. Where can I assist you, and where can I bring you help in your journey? If I had a patient with preeclampsia and having these severe headaches, what I would definitely say is, most importantly, I'm worried about you having things like floaters in your vision. I'm worried about your headache increasing. I want you to look out for those symptoms. I'm also having you look out for any dizziness and things of that nature, because that could be from this increase of blood pressure as well, meaning that things are getting worse. Also, abdominal pain. If you see that, I want you to alert me immediately, because that could be a precursor to convulsions, and I don't want the patient to have seizures. Most important medication there is going to be that magnesium sulfate, again, for the seizure prevention. Most importantly, unfortunately, magnesium sulfate is going to make you feel absolutely terrible, very much as though you have like something like the flu or things like that. However, we have to get you to feel that way for the medication to work correctly, and once you're off the medication, you'll no longer have these feelings. Most importantly is going to be, we don't want you to seize and things of that nature, because that is going to be the most harmful for the baby. Also, I think something else that I would kind of educate on would really just kind of be knowing, patients know their bodies very well. So when you know that something isn't feeling right, something isn't going right, because they might not always be able to kind of voice and verbalize the symptoms that they're having. So if something is feeling off significantly more so than even how it is in this current state of having the severe headaches and things like that, then please alert me, let me know so we can talk to the provider. Also, if they're having, low urine input as well, I need to be alerted so that we can get, a different medication on board as well. And I think that was everything. Thank you.